back pain. Next to the common cold, it is the second most common reason patients visit their doctor. In fact, Americans spend over $50 billion each year on back pain, the leading cause of disability in Americans under the age of 45 and the third cause of disability in those older than 45.
92% of the population at some point in their lives has back pain. That's essentially everybody. Common causes of back pain include trauma, injuries such as car accidents, work accidents, lifting accidents. They could be chronic in the sense that they're long-term wear and tear problems. Spinal stenosis is a condition in which you don't have room for the nerves that are coming out of your spinal cord, or even the spinal cord itself. And it tends to be in the chronic category, where long-term wear and tear creates a situation where you have less and less room for those nerves, so the nerves end up getting pinched, and you end up with sciatic pain radiating into your legs. Common ways to treat back pain that are non-operative include physical therapy, chiropractic treatments, different types of medications, injections, acupuncture, and all of these modes of treatment should be pursued before seeing a spine surgeon.
For many years, traditional lumbar spine fusion was considered the best surgical option for patients with debilitating back pain. This invasive procedure required a large 8 to 10-inch incision, a lengthy hospital stay, and months of recovery time. Now, advances in technology have transformed fusion into a word that carries a much better diagnosis.
What scares most patients about classic spine surgery is the fact that there are very large incisions, long operative times, there can be high blood loss, and it also involves long stays in the hospital. Recent advances in lumbar spine fusion surgery include the use of the microscope and the use of an endoscope, lasers, and special tools which allow the surgery to be performed through small holes rather than large incisions.
A board-certified and fellowship-trained orthopedic spine surgeon, Dr. Luis Quartarero of the NJ Spine Institute in Paramus specializes in minimally invasive surgery of the cervical and lumbar spine. This endoscopic lumbar fusion is a proven technique which achieves immediate results with smaller incisions, less pain, and quicker recovery time than traditional lumbar surgery.
My goal is to be able to perform a minimally invasive operation for whatever spinal problem a patient presents with. We can perform this surgery through 1 centimeter incisions, utilizing an endoscope and special tools where we're able to take out the entire disc, place the bone graft, place the cage, and place the screws, performing essentially the entire operation through a series of small holes with very short operative times, much less blood loss, and the ability to perform the surgery on an outpatient basis. Every time I perform this procedure, it is my goal to have the patient resting in the comfort of their own home within 24 hours.
One of the only spine surgeons in the New York metropolitan area performing endoscopic lumbar fusion as an outpatient procedure, Dr. Quartarero has expertly performed over 500 fusions and more than 1,000 microendoscopic dissectomies. Uniquely trained and certified in the latest techniques medical science has to offer, he believes in providing the best in care through state-of-the-art diagnostics and treatments with a focus on compassion for every patient.
I was involved in a bad car accident. I was hit at a very high speed on a highway. I had 9 herniated discs, tried every non-invasive pain management procedure, and knew probably in the back of my mind that I needed surgery. And at a certain point, I couldn't take the medication anymore and was referred to Dr. Q. Dr. Q performed neck and lumbar fusions on me. The first surgery, the recovery time was probably about 6 months. Easy, I was able to walk. It's the best thing that I could have ever done because there's no way I would be here if it wasn't for that. There's no way. So, and now I'm good.
Since I've started doing the minimally invasive fusions, I've had a much happier patient population. I was fortunate enough to be trained by Dr. Parvis Camden, who was one of the fathers of endoscopic spine surgery, and he trained me as a resident 15, 20 years ago. And his teachings are the basis of the endoscopic fusion that we perform today.
The best part about being healthy again is I'm an active person. and I couldn't spend the rest of my life not being active, so I would have had no life if it wasn't for him. I can do what I want to do, and I'm doing better probably than I was before this even happened. I'm a personal trainer. I teach kids, I train police officers. I'm moving 24/7. I never stop. I recommend Dr. Q to others every day. I work in fitness, so people come to me every day with back pain. How can I not have back pain? I have sports injuries. So I recommend him every day. There's no question. It's just a natural thing that comes out of my mouth. He's the best, and I wouldn't recommend anybody else other than Dr. Q. From the second that I met Dr. Q, I trusted him, and I knew that he would be the one to fix me, and he did.
As a minimally invasive spine surgeon, I think it's important to stay updated on all the latest spine surgical techniques and technology to be able to offer my patients the best possible operation. I enjoy what I do. I enjoy helping people. I like seeing them get better. Working in the operating room, surrounded by people that are excellent at what they do, and being able to do something that is going to potentially change someone's life. Spine surgery today is a lot easier to get through and a lot easier to bounce back from than what it was even 5 years ago or 10 years ago.
Why go home next week when you can go home the next day? If chronic back pain is affecting your quality of life, learn more about Dr. Corderero and the NJ Spine Institute today, offering the only true minimally invasive outpatient spine fusion surgery. For more information, go to njspineinstitute.com, find us on Facebook, or call the number on your screen.